Linda, look, thank you for enabling me to come along and have a chat today. It's got to be 6-7 years since I first met you, because I came along to the Coastal Disability Forum when you were based in Melton, and at about that time I was visiting the Waveney Disability Forum as well, and I suppose for me that's where I really began to get an insight into some of the challenges that people have if they have a physical disability.
I think it's probably fair to say I got involved with disability issues and the services and so on for disabled people in the early 1980s, and my experience therefore is with a whole range of organisations, but principally organisations that involve users of services, if you like.
Mm-hmm.
Not just physical disability but also learning disability, and all ages. And technically I'm retired, but I'm still involved with some of the disability forums that exist in the county.
Yes, yeah, and I was, you mentioned the different kinds of disability, and I was looking to see how many people in Suffolk are thought to have a physical disability. I was looking at the State of Suffolk report, and I think it mentioned, I was really surprised to be honest, I think it mentioned over 165,000 adults and 10 to 11,000 children who were considered to have a physical disability, which it's over 20% of the population. It's a very big number, isn't it?
It's now one in 5, I think, of the population, and when I began in the 1980s, it was calculated, I think, at 1 in 7. Right. So there are more disabled people now than there ever were, or maybe we're better at identifying some of the hidden disability. It's very easy to understand a wheelchair user must have a disability. It's not something you would do for fun.
When we talk about people with physical disabilities then, some people might think somebody's blind, or they use a wheelchair, but I think it's broader than that. People with, now you're going to know this better than me, but I think it's people might have developed arthritis and you know have real trouble with dexterity. They might have very significant fatigue through breathlessness. There's a whole range of ways. Yes.
It's something like 20% of disabled people are born with their disability, and the other 80% acquire a disability later in life.
Right.
So, and those would be people who develop arthritis and chronic lung disease and so on. The number of people with learning disabilities is smaller, but they are easier to count because they are known to local services in a different way. You can't really count people with physical disabilities because you don't really know where they are. So you may have lots of people who have a hearing impairment, but if you said to them, "Are you disabled?" they would say no. They would say, "I can do everything I want to do."
Yes, yes, yeah. So the challenges that people face, there's a whole multitude, isn't there?
A whole multitude.
Can you help me out?
Well, it's almost anything that affects your life. I will usually start in my head of thinking about access, because it's being able to get where you want to go, do what you want to do when you're there, talk to the people who you want to talk to. So access is hugely important, and despite the sort of developments of the Disabilities Discrimination Act and eventually the Equalities Act, we still got loads of buildings, particularly in Suffolk, that have steps that you can't get in.
Yeah.
And that's frustrating.
Yes. And that's, I've seen that there are surveys happening in different towns that have happened. I think I was looking at the one for Stowmarket and Needham Market, Felixstowe, Woodbridge, over recent years, as opposed to
Yes.
obviously not in the last 12 months, do you find that people are responsive when you've highlighted all the different ways that there could be improvements?
Not necessarily. They will say to you, they can't afford it. It's the building's listed. The landlord won't take any notice. So they have a whole range of excuses, if you like, as to why they haven't improved access.
Sure.
And I was involved in those surveys,
Yeah.
and they were really good. And they highlighted, you know, a number of shops, businesses, and so on that disabled people simply couldn't get in.
And if an organisation, a business, a council, a service, a voluntary sector service said, well, we'd like to, we should audit, we should look at ourselves. Is there a template, a template they can use, an audit survey, or can they come to the Suffolk Coastal Disability Forum and be guided?
There are organisations that do surveys, and I guess they cost a fair bit of money to do it. You can obviously ask the forums if they would go along, and some of them will, and some of them don't have enough people to do that. I actually enjoy doing surveys of buildings, but obviously in the last year or so we haven't been doing any surveys of any kind. So,
and presumably it's the buildings, but everything around the environment, in the high street. I mean, the classics are A-boards, aren't they?
Yes.
And
Don't they love to grumble about A-boards?
Obstacles, but obstructions, and then some things are so obvious. You know, looking at some of those reports, the bollards that are only painted black. You know, just helping to draw attention to where the edges of steps are, or some of them are possibly not big expenditure. It's more, perhaps even quite small expenditure, but just that attention to detail, thinking about how people are going to engage with that environment, how they can best do it safely.
I think it's about people are just a little bit thoughtless. They don't really mean to be. They just nobody's raised their awareness of those issues, and when you do, you know, they're quite surprised.
Yes.
You know, you talk about the bollards, and so we talked about them in Stowmarket, and the town council were really good and went out to highlight them, only to find that young people who have not much to do took the highlighting off again. And it's like having a doorbell so that you can attract someone's attention inside a business.
Yes.
The doorbell is quite likely to have been vandalised, so it doesn't work.
Very frustrating.
Those things are very frustrating.
Very frustrating. And sometimes I can see that the question of money, well, actually quite often the question of money comes up when you say, well, it would be really good. I was looking at an article, and it was a lady, I think in Haverhill, who had been trying to get a ramp into the community centre. And when I was reading the article, it said, you know, starting back in 2014, 2015, she'd started to say, this local community centre, I need wheels to get you know, into the building. I really need a ramp. And I think it was 5 or 6 years, with other organisations coming in behind her, that finally pushed that over the line, found the funding, got a concrete ramp put in. It wasn't a ramp of any, as I could see, huge size or scale. It was really quite a simple ramp with a rail either side. Does that frustrate people that it takes so long to what must feel like just an obvious, necessary?
It is frustrating, the length of time things take. And I often say to forum members, if you're here for quick fixes, you're not going to enjoy these meetings. You have to be in it for the long haul, because it can take a very long time. And sometimes you think you've dealt with an issue and it's gone away and it's been sorted, only for it to come back some years on. And I do find that myself frustrating. So I think I dealt with that, and now I've got to do it all over again.
Yes, yeah. Do the councils have dedicated officers to support people with disabilities? Is that, or is it part of different people's remit?
I think it should be in all of their remits, that they should be supportive, but they don't really have a specific, what you might describe as a disability officer.
Right.
The only council still left to have an access officer is Mid Suffolk and Baber, and his remit is to really within building regulations,
I see.
which are important.
Yes.
But he doesn't. I wouldn't describe him as proactive, having the time to go out and look at buildings and saying to the owners and so on, you need to make this building accessible.
Because I know that the forums are consulted, have the opportunity to comment on planning applications, but I suppose that only gives you an opportunity to input when there is a planning application. There's all the existing buildings, and I can see that the benefit of that kind of audit survey in-house, better than not at all, especially with the support of someone from a forum who can contribute. Maybe it's a member of staff who can do that, maybe it needs to be someone from a local forum who has a physical disability, and you need that co-production, you need that lived experience, presumably, when you do the survey, because otherwise you're probably just not going to see the problems.
You've got to be able to look at it from the point of view of lots of people with different disabilities, not just your own.
Yes.
So, and that can be hard at times, and you might miss something. It's better really if it's done with a sort of a small group, including someone with a physical disability, a visual impairment, and so on, because it helps you to remember.
You mentioned visual impairment and hearing impairment. I was in a conversation last week actually, and it was somebody who teaches around how best to support and engage with people who have visual hearing impairment, and they referred to it having being aware of a waiting room. I think it was in a hospital, and it was a hearing clinic where they call out the names of the people to be seen next, and then saying, but then in the visual impairment clinic they use a screen and they display on the screen the names of the person to be seen next, and reasonably was saying that no one means any harm in what they're doing, they've just not thought it through, even when professionals who are specialising in that clinic area have not thought it through. Is that something you come across quite?
Oh yes.
Are you surprised, or are you like?
I'm not surprised. I'm not surprised at all. You sit in a hospital waiting room, and a nurse comes out and mumbles the person's name that they want to go in next, and you think, well, I don't think anyone will have heard that, even if they haven't got a hearing impairment, because it isn't said sort of clearly. And then you've got the numbers that pop up on screens and so on. Yeah. And it's all very, very difficult for people to understand. And it's been hard in the last year, because if you have had to go to hospital and so on, you've had to go alone.
Yes.
So you haven't had your sort of support, family and so on with you.
Have there been exceptions? Has someone who's needed a carer with them to support them, or has there been quite a rigid application?
Certainly in the field of learning disability there have been some exceptions. And that's only right and proper that it should be, because it's very, very scary for people with learning disabilities. And
what should change? What do you need people to do, or is it kind of obvious almost in a sense?
It is obvious, isn't it? I wish they would listen properly. I'm used to sit in meetings where they would say, I hear what you say, and you think, no, you're not hearing what I'm saying, because you're not listening to it. And that's what I think still doesn't happen.
and then that translation into going away and having a really good look, presumably, and a good think about, so what is it that, I guess the risk is that everyone assumes that that practice is somebody else, what somebody else is doing, rather than actually taking on board that it might be themselves.
I guess so. You know, someone else will sort it.
Either someone else will sort it, or it can't be happening in our place, because we wouldn't be doing that.
Mm.
Meanwhile,
Meanwhile,
it's,
yeah.
oh dear, yes. So what would your, presumably the offer from the forums is, and they are in Waveney and Mid Suffolk and Coastal
and Forest
Heath, but from all of those disability forums, they're free to participate in, I think. Is that
Yes.
right? And anyone who is working for an organisation that includes supporting people who have disabilities, I think would be welcome to come along. Is
Yes.
that fair to say, whether they're statutory or voluntary or a large or a small group or service? And of course people who themselves have a physical disability.
It's very important that people with disabilities themselves go along to the forums, as well as representatives of
Sure.
organisations, because you can't understand it, what it's really like to have a disability unless you're listening to people who do have.
And I can remember being in the Coastal Disability Forum, and the question of engaging with services at a distance was being discussed. I suspect it's being discussed in every forum, particularly in the light of COVID and you know, GPs wanting people to use e-consult and not seeing people necessarily face to face so often if they've got, say, cancer and then clinics being closed completely. How has this move to digital engagement affected people, do you think, Linda?
I don't think disabled people are very much different to any other person in terms of the sort of move towards having telephone conversations and e-consults and so on. So for some people they like it. They think we don't have to travel, we can just pick up the phone and so on. And for others they say we feel abandoned by the medical services. We can't go to see the doctor, we can't see the consultant face to face, and for them that's very difficult. So it's the same sort of mix, I would guess, as you get with anyone.
Yes.
But it has some more complications in that if you can't hear, if you can't speak, if your communication is really difficult, then you're a bit more disadvantaged than others.
Yes, I can see that. So, Linda, you were mentioning the impact on transport, on housing, on employment of having a physical disability. Please tell me more.
Let's start with housing and say how important it is to have a house that you can live in and be able to get round it and access it all. And there are so many people who are further disabled by the unsuitability of their housing. And if you want to move as a person with a disability, well, that's kind of difficult, because you can't easily buy a house that's accessible. Now, some people think that all you've got to do is have a bungalow, and well, that's not the case at all, because you know the bungalows can have narrow doorways, a little hall, a bathroom you can't get in, and so on. So we tend to live in what I would describe as a compromise. So this bungalow that I live in is a compromise. We have adapted and altered it and made it as accessible as we can. But if I'd had loads of money, I would have built a purpose-built wheelchair accessible bungalow from scratch. So it's very important when we're, as forums, we're talking to planners about the applications, that we remind them that they need to be meeting the building regulations and including properties that can be easily adapted and made accessible.
Do you see that happening? Do you see that the council's asking for a proportion of properties to include accessible?
I think when we get the local plans sort of sorted again,
yes,
that it will be better.
right.
But at the moment, I think we continually say to the applicants, are your houses going to all meet Part 4 of the building regulations? Are they all going to be visitable? Are half of them going to be accessible and adaptable? And sometimes my colleagues say, do we have to say this again? And I say, yes, I think so. I think we say it over and over again until they understand.
I think I was seeing that in terms of people of the older generation, aged of 65 plus, the number of people with a physical disability in Suffolk rises to more like 45%. So I can see that there must be a constant sort of wave of people those people who develop a physical disability later in life, who are needing to change property and are needing to find a property that can be accessible to them. So
yes.
It must be an ongoing, ever ongoing challenge.
Yeah, I think it is, and they talk about it's important that older people can downsize into something more suitable, but you don't really want to be caught in a little box flat somewhere. You want something that is nice for the little garden and
yes,
something that you can enjoy.
Yes, yeah.
So housing is to be something that shouldn't be forgotten in the world of disability.
Thank you, thank you. And we talked about employment and opportunities for employment.
The statistics still show that there's something like 1 million disabled people who would like to work, who can't get work. So it's a very high number of disabled people who still have great difficulty in getting employment. So,
do you think that employers do enough?
I think employers are a little bit afraid that disabled people are going to be expensive. They're going to want lots of reasonable adjustments to their businesses, and they're going to have a lot of time off sick, of course, aren't they? Well, the statistics would tell you that disabled people are no more likely to be off sick than anyone else.
So you want employers to be brave and bold and think actually that that person can enrich our culture, our knowledge, our experience, and perhaps bring something different to the mix.
Yes, I think that would be so. Yeah. I mean, but of course we don't see many disabled people at the forums who are in work, because quite rightly they shouldn't be joining Zoom meetings during the day, should they? They should be at work. But we're still aware that it's difficult. And if you were to sort of probe into the statistics that you can find online at all sorts of sites, you will still find that education is not as good for people with physical disabilities.
Throughout school, college and further education?
Well, I think it's improved, but I still think that your chances of getting qualifications are harder. And there is, if you say you want to go to university as a wheelchair user, then you've got to think about, is it accessible to me? What sort of care do I need to be able to enable me to go? And can I get the funding to make it possible? So it becomes more of a challenge than, okay, I've got my A-level results, I'm off now to my chosen university.
I'm thinking that it'll be much more likely that people's choice will narrow down in some cases to where's the one still near home, that I can still live at home and go to university in order to make that possible.
That can be the case in some instances, but I can recall when my daughter went off to university, her tutor was telling her, go far away from home, that they can't visit you. So the business about being independent as a young person is harder
Hmm.
if you have a disability than if you didn't.
And I suppose it would be very positive to have younger people in the forums who have a physical disability, to have all ages basically in the forum, so they would be very welcome, I'm sure.
Indeed they would.
Yes.
Mm.
Yes.
But young people don't tend to think of joining something called a forum and join a meeting, do they? Not really.
Not unless they have to.
Yeah. I wouldn't want to make them come.
No, no.
It feels cruel.
Yes. Do you have a link up with like the University of Suffolk or Suffolk One, or does the spider web of the kind of disability forums extend into any colleges or?
I don't think we have good
education?
links with education. Not at the moment. But it's perhaps something we need to think about as forums as to how we do that. But you know, we are limited in numbers, and we're all
Yes,
volunteers.
Absolutely, yeah.
And you can't spend 24 hours a day thinking forum issues. It's just.
I guess you could then go and links into all the businesses and links into where would you kind of stop, and as you say, people are kindly contributing that time to help the forum to exist and to function and it must take when it comes to things like looking through planning applications and feeding back on them. I would think that's quite a time intensive. People are giving up a lot of time to help make that happen.
Yes, I mean sometimes you've got sort of 100 documents with one application.
Okay.
And it's very, very hard.
Do you get support? Do you get support from the council to do that?
No, we choose to do that as a forum. The council supply us with a support in terms of an officer support, and that's usually someone from one of their communities teams, and that works very well. And they'll be very good at hosting the meeting and assisting in that way with the sort of nuts and bolts of running meetings.
Sure.
But I don't think they have time to think about how can we facilitate to comment on sort of planning applications.
Right.
And not all the forums do that.
Right.
Partly I think because they haven't the number of people.
Just the resource.
Yeah.
Are there any other sort of areas that you feel we should really?
I suppose that I would be remiss if I didn't say that disabled people often say that transport is their biggest issue. So the ability to be able to get out and about with not so many buses these days.
Yeah.
Lots of improvements, of course, in terms of public transport, in that buses are accessible these days.
Yes.
And there are more wheelchair accessible taxis than there ever used to be. So many improvements, but it still can be very isolating.
So where the buses are going to and how often is going to affect everybody, but perhaps if you've got a physical disability you're less likely to be driving yourself, I guess.
Less likely, I think,
Less.
yes.
If you are taking the car,
Yeah.
what kinds of challenges are people facing when they're disabled that others might not be?
As drivers,
And parking and...
right, so parking, of course, is a big issue. So it's frustrating to find blue badge spaces occupied by people who are not blue badge holders, and that's not uncommon to find that. Parking spaces need to be large enough, so it's all too common to find someone who's splashed a wheelchair symbol on a space but not actually thought about the dimensions you need in order to be able to get in and out of your car, so on.
And the amount of time that you're allowed to park, that seems to vary.
Well, it's if you're parking on street,
Yeah.
The guidance is national, so you have
Right.
3 hours,
Right.
and you know that. That's fine. It's when you park within, say, a council-owned car park
Yes.
that there are differences.
Yes.
So some will make no charge at all to blue badge holders, and others will charge the full parking just the same as anyone else. And if you say, I'm not sure that that's fair, they'll say to you, but you want equality, so that's how it is. But of course we don't have equality, do we? Because it takes longer to load and unload your car, longer to do your shopping and so on, because it just takes longer to get where you're going. So
if you have to start by lowering the ramp at the back of a vehicle and then coming down that in a wheelchair and having undone the straps and so on that holds that wheelchair secure, and then put it all away, if you like, ready to return, you're spending the best part of 10 minutes at the beginning and the end. So the free 30 minutes parking doesn't really give you
it doesn't really allow you very much, does it? But it varies, and it's so it would be good if it was the same everywhere across the country, but of course it isn't. So you go out to a different area from where you live, and you need to be very careful about reading the signs.
I'm sure you do, and that's become, I think, a bit even more tricky, because more often now we're seeing an app. It's not a machine with a board clearly displayed. There might be one of those somewhere in the car park if you can find it, and any other machine is now, to go to such and such an app.
Yes.
And that makes it perhaps even harder.
I think it makes it harder and more complicated. So you can't just put some money in a machine as you
or necessarily have a board there telling you what the rules are. It's usually somewhere in the car park, but car parks can be pretty big places, and I suppose it becomes even harder if you're in a wheelchair to go and find the board that tells you what the rules for that car park are.
Yes, especially if the surface of the car park isn't great.
Surfaces, that's an interesting one, isn't it? Do you think people, I might walk over that bump, that slightly raised pavement, that little pothole, and it is almost irrelevant, I guess. But in your chair, I guess it's anything but irrelevant.
It's not irrelevant at all. So you spend your time staring downwards, saying, "There's a hole coming up. Go left, right, or whatever."
Yeah.
And to cross a road, okay, you may have a drop curb one side for the pavement, but on the opposite side of the road where you're going, there isn't the drop curb. So you've got to go a distance down the road to find it.
Sounds like it would be a wonderful thing if town and even parish councils by default did a sort of, I don't know, biannual, I'm making it up, sort of internal, an audit of their town together with a small group of people who have different disabilities, just to kind of take stock and go, if a councillor could kind of own that as an ongoing in every town, in every parish, and actually really have a good think about it, and then they might come away going, yes, we know we still need to do this, and we still don't have £30,000 to put in that facility, but we acknowledge.
I think parish councils used to do a footpath walk.
Okay.
I don't know whether they still do, but I don't think they thought about that in terms of access for disabled people. I think they were more looking at it to see that the footpath was still clear, and some farmer hadn't dug it up and incorporated it into his field.
Yeah.
But I don't think I've ever had anyone sort of walk the footpaths, except, and it must be a couple of years or so back now, Bury St Edmunds invited a number of us to walk with some counsellors through Bury St Edmunds to show them some of the access difficulties, and that I think was very illuminating for the counsellors, and it certainly made them much more aware. So it would be good, I think, if more towns and villages did that.
Sort of owned it. rather than a disability forum saying we'd like to come and do the survey in the town. Wonderful if the town said we want to, as a matter of course,
yes,
be looking and thinking and have your help to do this, please. But actually, we recognise it's our responsibility, and I think perhaps there's a sense that because people aren't thinking about all the different ways in which people are disabled, they don't appreciate just how many 165,000 adults in the county. This is not a few people, is it? This is a heck of a lot of people. So for them as councils to be doing this is actually meeting a need of a lot of their population. That's my view, that's my feeling.
You could say, couldn't you, that they would be meeting the disability equality duty.
And that's a necessary thing for
and,
them to do.
And they should be doing that.
Yes, yes.
But,
let's hope it kind of needs to come from the heart, doesn't it? It needs to come from kindness and actually wanting to help people, because that's then where the energy and I think, you know, the drive can come from. And it doesn't need, it'd be nice if everybody did that, but it needs some passionate individuals in every council, I think, to really care and drive that forward.
I think you're right. I think, you know, without that passion and will to do it won't happen.
Let's hope that some people might watch this and think, I want to, you know, I could do that bit more, and I want to think about this and reflect on this and do that bit more in my community and in whatever sphere of influence I have. And I know some people watch this and have a lot of influence. So you people, please listen to this and try and make a difference.
That would be good.
Thank you, Linda.
Thank you.